In this video, we'll talk about what to do after having a tooth removed. So after having a tooth removed, or teeth removed, it's important that you take a number of precautions to help with the healing process. So number one, you really should try and keep the blood clot in the socket. So what that means is you have the tooth removed, there'll be a little bit of bleeding in the socket. We want to make sure that the blood has enough time to gel and turn into a blood clot. So that means you should keep the little gauze pad you have on and bite down firmly on it for about 10 to 15 minutes. And that will not only help the bleeding stop, but it will stabilize that blood clot as well. Sometimes we will be placing stitches or little devices that help control the bleeding. But we find that pressure and care around the area is certainly the best and easiest way to prevent a problem. Occasionally after an extraction, the blood clot can break down, leading to a condition we call dry socket. Now, a dry socket usually occurs within 2 or 3 days, sometimes even up to 5 days after the extraction. So it can be very painful. If anything happens, please give us a call straight away so we can assess the site and treat it in the best way possible. After 15 minutes or so, you're allowed to remove the gauze pad. It's important then though to avoid rinsing your mouth very often, spitting out, drinking through straws, anything that could increase the pressure in your mouth and dislodge the blood clot from the socket. So the blood clot, it will take a number of hours until it's firm enough that it can go back to your normal routine. It is also very important that you avoid any heavy exercise or physical activity. You don't want to do anything that would increase your heart rate, and that could lead to bleeding as well. After having an extraction or any surgical procedure, it's normal to have a little bit of swelling, bruising and pain as well. So you could try, if you want, an ice pack, sometimes even a bag of peas out of the freezer, just to help keep things under control and give you some pain relief. Your dentist might have suggested that you take some painkillers or even some antibiotics after your extraction. It's important that you follow your prescription by the book and you take the medication as prescribed. Taking a medication as prescribed will ensure that you have a trouble-free healing, and it also prevents pain. It's a lot easier to prevent pain than to try and treat it. You should continue taking your antibiotics even if there's no swelling or signs of infection. That will prevent the infection from occurring again. After 24 hours, you can go back to your normal oral hygiene routine. It's important that you keep the teeth clean and the area around the extraction clean as well. You can use a soft toothbrush and very gently brush around the area. It's best to avoid mouthwashes for the first 24 to 48 hours, again just to prevent the blood clot from being disturbed. After a few days, you should feel fine and you can go back to your normal routine. If there's any issues, make sure you give us a call and let us know.